Hello, thank you for taking the time to watch this webinar on how to interview a potential medical doctor or nurse practitioner, a professional person who is licensed to render care and sometimes even make a diagnosis, to render treatment, services, what have you. Properly interviewing a potential healthcare practitioner is critical to the future of your success. This face-to-face interview should be scheduled after this practitioner has provided a resume. And although the question I'm going to outline and some of the questions and concepts I'm going to discuss in this video are basic, they are the key component of making an interview successful to find out as much information as possible, including and not limited to the short and long-term goals that this practitioner is trying to accomplish in the future. You should know that. I've said it before in other videos, and that is that when they asked Bill Gates, the famous developer, or I should say owner, or at least the major shareholder of Microsoft, they asked him, how did you become so successful? What did you do? And he said, I always surround myself with people who are smarter than me. This is an important component. So it behooves you to ensure that the applicant is a suitable match for your clinic. And not only that, but your patient's health care needs will be taken care of in the way that you think is appropriate. You need to, however, be very careful and only ask the questions which are pertinent and applicable to the physician or the nurse practitioner, and not ask questions which are either personal or not allowed to by law. You need to make sure of that. I'm not an attorney, so I'm not going to advise you as to what you're allowed to say, not allowed to say. But there are state and federal laws that prohibit you from saying certain things. So make sure you're aware of these things. This is not the video to watch about that. Call your attorney or local advice counselor to let you know about those things, so making sure that you're processing an interview in an appropriate manner. Now, here are some of the questions I believe, however, that you should ask. And the first one should be, what type of duties did you have in your previous employment? What is it that you did? You want to know this because it'll give you a better understanding of what it is that they have been trained and are comfortable doing from the previous job. It's possible that some of the things that they've done in the past, you do not offer in your clinic. That's also an opportunity for you to review those things and say, wow, I didn't know you could do that. This is great. Mark that and make a note of that, because this could be a service that you now could be rendering at your clinic, since they've been trained on it and they're comfortable with it. In that question, ask them also, what kind of procedures are they either certified or licensed to administer? Find that so that you have an idea. It's quite often that nurse practitioners or medical doctors or other healthcare professionals go and get trained and get certification in certain types of services. They may have gone to an ultrasound-guided injection seminar, and they may have been certified to do ultrasound guidance now and use them when they do the injections. This could be important to know, because now you know they have the ability to do this, and they were certified in it. It will make a difference. You also need to know, because it will make a difference as to how you make the determination about their pay rate and the kind of compensation you're going to offer them. Ask them if there is any kind of equipment that they are familiar with or that they're confident using, and specifically mention the things that you have in your own clinic. For instance, let's say you have a C-arm in your clinic. Do they know how to use it? Have they used it before? Would they feel comfortable using it? And if so, to what level? Ask them and make sure that you get the greatest understanding as to what it is that they're trying to do in your clinic and the way you want them to. Ask them, how qualified are they with their medical procedures? In those procedures that they are rendering, do they feel comfortable? Just a client of mine recently told me, said, the nurse practitioner I'm hiring is just not comfortable in one of the procedures that they were doing. Get them trained. Make sure that they go out and get trained. Make sure that they go back and whatever seminars they have to take, whatever training they have to go through. You certainly don't want to be the clinic where they're going to use your patients as a training balance. It's not the way to do it. And if they're not going to be comfortable at it, or they're not comfortable at it, they're not going to do it properly, you're not going to get the outcomes that you want. Certainly the patients might get hurt. Where are we going with this? Doesn't make sense. Ask them also another question would be if they have prescribed DMEs before. DMEs is a large component of musculoskeletal treating clinics. And you want to know, are they qualified to do so? Did they get certification? Do they understand it? How often do they do it? Makes a big difference. Ask them also if they worked with diagnostic services, NCVs, SSCPs, BAPs, DEPs, AMGs, all of those diagnostic services. Have they ordered them before? Do they understand the indications and contraindications? Do they understand the availability and applicability? Do they know what a corollary is? And would they be able to use it? Meaning, when a patient comes in, when would you order it? And to what effect? And what test would you order? Would they know how to do the testing itself? Have they used the equipment? Have they read the testing before? Do they know what to do with the results? These questions should be thoroughly investigated and questioned in such a way where the doctor, nurse practitioner will give you that information so that you feel confident of what you're saying, what you're hearing, and the things that you would want to make a determination on to see whether or not that person is the right person. Also, find out how much time do they typically allow for a new patient. How long is that? Is it just a few minutes? What is it? And if so, to what effect when they do this examination? How comprehensive are they? Some doctors are very, very, very detail-oriented. Others, quick through it. Chief complaint, soap notes, done, out the door. You would want to make sure of that. Is this okay with your philosophy? Is that the way you treat your own patients? And you would want to bring in somebody who does something similar or better than your office so that you can enhance your protocols in your office. Next question would be, how often do you change the diagnosis and the treatment for a patient? How often? Some doctors do it more often than others. Some do it on a regular basis, every 10th visit, every 5th visit. You would want to ask that question. That way you're comfortable and confident that what you've got is what it is that they're doing. It doesn't mean, by the way, if they give you an answer which disagrees with you, that this is a deal breaker, that this is something that now will have to stop the interview. No, find out about it, because many of these things sometimes can be either discussed, exchanged, negotiated, or trained, taught between each other. Wow, I didn't know that. You know what? This is a good idea. Maybe I should start implementing it myself. That's all there is to it. But pay attention to those details, because those will make a difference. You don't want to spend, like I said, all the time to hiring this person and then finding out later that is not the right person. It's going to mess up your clients, mess up the schedule. It's going to cost you money. It's going to take time. Not very smart. Not the best way to do this. Another question. Ask them on the confines of taking notes. Are they confident in taking notes during their documentation? Is it something that they do easily or not? Is it something that takes them time? Sometimes I'm amazed. I speak to some of my clients and they tell me, they can't even take notes. I don't understand it. My first question is, how did you not know that? Did you not review this at the initial interview? Did you not ask them? Are they comfortable with it? You should find out from them whether or not they know. At the same token, you have to ask them also, have they worked with any coding or any kind of billing? Do they understand it? Is that something that they learned, they understand, they work with? What is that? It does make a difference. You want to make sure that they are aware of these things, and you should be aware of it so that you realize whether or not this is something you can discuss with them. I'm not saying that they have to be certified coders and they're not going to work in the billing office, but it's important for them to know what codes are they using. Are they applicable to the type of service? Do they reflect the type of service that they've used? It's not just a checklist. It's not just a number. It's something they need to understand. And if not, then you know what? Let's do some training. Let's review it. Here is a manual. Here's something that we're going to review. Here's something I'm going to sit down with you and go over it so that you understand it. Another question would be, in the dispensation of medications, what type of person are they? You have some people that dispense all the time. Take this, take this, take this. Others, hardly ever. It's It's interesting. I had an orthopedic surgeon working in my office when I was in practice. As you know, prior to becoming a consultant, I became a consultant back in '94, just years ago. I was in practice for approximately 10 years. In those years, I had two very successful centers. My clinic was huge. We had 5 practitioners, an orthopedic surgeon, a neurologist, an internist, a cardiologist, and a family practitioner. These guys worked in my clinic, and they were phenomenally successful. We did amazingly well. Believe it or not, this is back prior to '94. We did millions of dollars in collections. Because of this success, obviously, there were all kinds of things that we had to look at and things that we had to pay attention to. And one of them was my orthopedic surgeon. He refused, for whatever reason, he just refused to give out any medication. Patient could be coming in pain. And he was just doing multiple types of surgeries on any given day. And we were the biggest providers in town, actually. And not only that, within a wide variety of services, and certainly within a large radius, we provided all of the knee surgeries at the time. And he was well known, graduated, top of the class, best school. And the patients started complaining about him. Why? He said he refused to give medication. He would ask them to pray, or to take it easy, or to think about the pain, or to meditate. You just can't do that. It doesn't make sense. If a patient comes in and they need the medication, they need the pain, and they had the surgery, and you told them you were going to give them something, you can't just say, I hope you can pray. That's going to take care of you. Can't do that. And I'm not saying you have to give medications to everybody, but you should know from the type of person that you're hiring in your office. Are they or are they not dispensers of medications? Do they freely give everybody 10 of each, 5 a kind, and take it all? Or do they say, no way, unless you're dying and you're in the hospital, I'm not giving you a thing? Where are they? They shouldn't be all the way to the left and shouldn't be all the way to the right. Somewhere in the middle. You should always have somebody that's somewhere in the middle. Extremes are not good. Extremes in anything are always dangerous. Another question that you would want to ask is the availability of their hours. Initially, especially in most clinics, most of these professionals are not going to work full-time for you. If they're not going to work full-time, then what will be their availability? And if so, what will be the availability that they're giving you to have in your office? Also ask them, what kind of compensation are they looking for? There's nothing wrong with that. It's not so much that I'm offering a certain amount of money. I just want to know, what are you looking for? They may have a dream, they may have a wish, they may have a desire, they may have an eager ambition to make a certain amount of money. Fine, let's just discuss it. It's not so much what you're offering that matters. Let's separate that. The key is to find out what it is that they want to do and help them reach that goal. I believe in hiring people who are motivated to help me build this huge enterprise. And I want to make you a partner in that. I want you to work with me on that. I want to work together. I'm a strong believer in making everybody a partner in what I do. Always. Work with people, work as a team, build it up, make sure that they benefit from that. The world operates on a team basis. 2 heads are always better than 1. No matter what situation you're facing, no matter what the challenge is, working together as a team always gives you the opportunity to do more and greater than you've ever had before. Another question would be if they have malpractice insurance. Find out about that. If so, have they ever had any kind of claims filed against them? Have they ever had any kind of disciplinary actions against their license? Those are the things that you would want to know so that it makes a difference in your interview as to whether or not you're going to work with them. Last but not least, one of the questions, and again, as I said before, there are many other questions, okay, so that you would want to pay attention to that and make sure that you ask these thorough questions. By the way, our clients, we give them a whole list of all the questions that they should ask because we want to make sure that when our clients do and perform the interviews that they have the information that they need so we can make a decision. After they have spoken and met with the nurse practitioner or the physician or the healthcare professional they're hiring, we ask them to call them back and we go over with them step by step the pros and the cons so we can make a good decision. That, by the way, is one of the reasons why our clinics are so successful. we hire the right team, and we put in place the right team, and that makes a difference. One of the last question that one of the questions, but certainly was towards the last part of the interview that you would want to ask is the short and long-term goals. You want to find out from that person, what is it looking for? What is it that they're trying to do? What are they trying to accomplish? If they say, just trying to get through the day, just want to get my pay and I want to go home, that lets you know that this person is short-sighted. They're not looking to establish themselves or do anything great. They just want to come in, clock in, do their work, get paid, and get out. Not the best approach to life, and certainly not the best match for a successful clinic that you're trying to build. You would want to find out from them, do they have short-term goals? What are they trying to accomplish? What are they trying to do? What about long-term? Where would they see themselves? This makes a difference. It makes a difference because it gives you the opportunity to understand where they're coming from, where they are today, and where they would like to go. You should, of course, do that yourself, but certainly when you're hiring somebody or working with somebody and trying to bring them into your clinic. Interestingly, irrespective of your conclusion and this evaluation, you make sure that the interview is always ending, always, in an enlightening way, always, in a positive note. The person needs to leave your office uplifted, encouraged. Something that they would want to always walk away from and say, wow, what a nice place, what a great person, what a great clinic. Even if you believe that they are not going to accept the job or you're not offering them an opportunity, whatever the case may be, walking away from a meeting where you feel uplifted and encouraged and given a hope, a prayer, and an ambition that shows you an eagerness to succeed is so comforting. I always love it when I meet somebody. Just recently I met with someone who does large investments, and they wanted to talk to me about all kinds of different things. And when I left the meeting, I just thought this person was phenomenally kind, amazingly kind. Now, that person happens to be extremely well-to-do, but they didn't act it that way. He didn't act as though he was in charge and this was his money, his office. No, to the contrary. He acted as though he had all the time in the world for me and gave me the opportunity to express myself, asked me all the questions that he felt were necessary, and then gave me the opportunity to ask all the questions. Think about that. Being the person that you're there and walking away feeling greater about yourself than you did before you went to that meeting. That's how you want everybody to feel when they leave this interview or they leave your presence. As always, I wish all the best to you and look forward to hearing good news above and beyond. And let's make it happen. God bless you in everything that you do. Thank you. Please subscribe to my YouTube channel and click the notification bell to get my latest update.